Okay, looks like the meeting recording has started. Can everyone else hear me?
Yes.
Okay, fantastic. Thank you. So my name is Montserrat Oni. I am Social Services Chair for Community Board 17 and officially calling this meeting to order. Good evening, everyone, and thank you for joining. So we would like to start with a roll call. So when I call your name, could you please state your name for the record and your relationship to this committee? And would start with Nkechi.
Yes, of course. Good evening, everybody. Good evening, everybody. My name is Nkechi Udizo. I am currently a master's in public health student, and my major is health policy and management, and I'm here to speak about Intro 1303 2025.
Sorry, you're here to talk about what was that?
INT 1303 2025.
Okay, thank you very much. Holly Michelle.
Hi there. Thank you. My name is Holly Michelle. I'm a public health advocate and doula, and I am also here with Nkechi to speak about Intro 1303.
Okay, thank you. Welcome. Isabel.
Good evening. I'm Isabel Pichardo, also a public advocate in support of 1303-2025, here to bring awareness to this cause. Thank you.
All right, thank you. Marie Jadot.
Hi, good evening, everyone. I'm just a community member and I'm here just to listen. And
Fantastic. Could you please state your full name just for the record?
Marie Jadot.
Fantastic. Thank you. Khadija, could you please state your name and relationship to the committee for the record?
Okay, good evening, everyone. My name is Khadija Alua. I am a committee member and a community board member too.
Thank you. Christina.
Hi, good evening, everyone. My name is Christina Meji, and I am a Master of Public Health, Health Policy, and Management student, and I am also here to bring awareness to Intro 1303.
Thank you. Joseph.
Hi, everyone. My name is Joseph Tino. Along with my fellow classmates, I'm also a public health and advocacy student here to advocate in favor of Intro 1303.
Thank you. Kai.
Hi there, my name is Kai Purnell, and I'm a community member and School of Public Health student, also here with my classmates to advocate for Intro 1303 2025.
Thank you. Sabin.
Good evening, everyone. My name is Sabin Jacques, community member. And so I'll be listening in and, of course, providing any recommendations and solutions as we discuss any upcoming issues. Thank you.
Thank you. Samantha. Samantha, I see you came off mute, but I can't hear you. Not hearing anything. I will move on, and then if you can fix your sound, please feel free to jump back in. Trisha.
Good evening, everyone. Trisha Lewison, Community Board 17, First Vice Chair.
Welcome. Cecilia.
Hi, Cecilia Hubbard, and I'm a community board member.
Welcome. Thank you. And Tiffany.
Hi, everyone. This is Tiffany Anderson. I'm a community board member as well.
Thank you all. Samantha, were you able to change your audio? If not, Nadine, please just mark Samantha Lawrence's attendance today. So welcome everyone. Thank you all for joining. Welcome to our guests. We really appreciate having you here. My report for this month is pretty short. I've been ill, so I wasn't able to attend the community board meeting last week. So really just want to focus on solidifying some topics for our newsletter section for the next few months, as well as securing our guest speakers for remaining social services meetings through the rest of our board year, which will go through the summer. So currently in talks with the Red Cross and an HIV awareness education, as well as an elder care and memory care facility. And so hoping to have speakers for December, January, and February lined up. If anyone on the committee knows organizations that would like to join our meeting and share some information, possibly host a workshop or even a in-person workshop at the community board office, please let us know, and we're definitely open to that. But I will keep it short. That ends my report. Any questions? Okay, hearing none. Move on to approval of meeting minutes. Ms. Lyons, do we have quorum to approve the minutes today? And that wouldn't be counting the guests that we have. Does anyone see the community board? Oh, she's there. Ms. Lyons, are you there? Okay. So I will move on from the meeting minutes, and if she hears me, we can move back to that. So for new business, as I mentioned, we have talked about adding a social services section to the monthly newsletter that goes out from the community board. And we had a member who, Vanetta, who wasn't able to join today, but who is a physician and has offered to, oh, Vanetta, you are here. Could you introduce yourself for the for roll call?
Hi, I'm Vanetta Sylvester. I'm a committee member of the Health and Social Services Committee.
Thank you for joining. So we're just talking about the newsletter section. So I know you had shared some topics that you could potentially discuss, and then I pulled together a few other ones that I thought we could talk out and would like to hear people's thoughts on what topics we want to choose and solidify for our newsletters. So I'm gonna pull this up. So the November newsletter went out last week, but for December, between winter immunization prep, talking about flu shots and updates, or HIV awareness, does anyone here have thoughts on either topic that we could write like a brief, 1 to 2 paragraph message about to share with the community? And if you see something on any of the other months that you want to bring up, please feel free. Can you all see my screen?
Yes.
Yes.
Great. So I just want to open to discussion. Would love to solidify a topic for December and January possibly today, so that we can get started on drafting them and sharing that with the board office. So does anyone have thoughts on topics they think would be, would better serve our community, or if there's something I don't have here that you think would be a good idea, please feel free to speak up.
And when you're doing the winter one, I think it's great, but if you're going to include the flu, maybe you should also include RSV, since the numbers are going higher in those areas too.
So are other people aligned with focusing on winter vaccinations overall as the topic for December?
I agree with that as well.
Okay. Any opposition?
Would it be that we're only focusing on that one?
Yeah, so because the community board newsletter is already quite long, we just wanted to be, 1, 2 paragraphs top. So we want to just pick one topic per month.
Okay.
And we can
I'm
also
still in.
move.
Oh,
Sorry, go ahead.
I was saying I'm still in agreement with vaccination, but if any other ones, it could also be like with SAD and mental health access too, or even like food insecurity for going into the holiday season.
I was actually going to consider maybe the SAD. I know that's something that picks up a lot. And this is the awareness month, if that's an option.
Yes. I also agree. I also definitely agree that vaccination is very important. I mean, we are in the United States of America, and in other countries like in Africa, we do not have the resources that we do have here. So I feel like high vaccination uptake is very important because it protects both individuals and the entire community from infectious diseases. And being that we have the resources to go ahead and get vaccinated, unlike in like Nigeria, Liberia, other nations of Africa that do not have health insurance available. So I feel like it's a very important issue to be taken into consideration.
Thank you. Any other thoughts on the December topic? Okay, so I think what I'm hearing is that we're between immunization prep and seasonal affective disorders. So I'm happy to take a vote. Does everyone know how to use the hand raise function? We can vote using the hand raise. So if you think we should focus on immunization vaccine, that would be flu, COVID, RSV, please raise. Were you going to say something? Okay. So please use the raise hand function if your vote is for vaccinations. Okay, I don't see any hands.
I'm sorry, you don't see my hand? I just raised mine.
I don't. It's near the bottom. Oh wait.
I also raised my
It
hand.
shows in the participants list. I can see it too.
Got it. Okay. Usually it pops up. Thank you. So I see
Yes.
Samantha, Cecilia, Khadijah, Marie, Trisha, Vanetta. Okay, so I had 6. Thank you. And then for seasonal affective, if you can all take your hands down, and then for seasonal affective disorder. I guess Isabel, to your question, if you are like local to Community Board 17, then please feel free to vote because membership in the committee is open. Okay, I see 3 hands. Sabin, I noticed your note about please considering mental health. I like it wasn't discussed. We're just discussing December right now. So seasonal affective disorder is a mental health topic, but if we feel strongly, we can maybe do that for January or do like a more mental health focused topic for January. But just want to get the December topic locked in. Okay, so I think I have Tiffany. What was your vote for?
Sorry, I
Okay,
couldn't get
3.
off mute. I had it for the seasonal affective. I didn't realize I took my hand down early.
No problem. Okay, so looks like we're gonna focus on immunization prep, flu, COVID, and RSV. So Vanetta would love to connect with you about getting a draft and sharing it with this group, and then getting it to the board office on the earlier side, and then winter is long, unfortunately. So for January, had thought about, glaucoma prevention or like a healthy weight reset and giving culturally relevant nutrition tips. But I'm going to add the seasonal affective disorder as an option for January, and then just go through the same voting process. So first, I want to just open it up to discussion. Does anyone have thoughts on any of these topics as January's newsletter subject?
Well, the glaucoma topic is really important. Speaking from personal experience, my grandmother has glaucoma and she's been having some complications. So I think that's something important, especially for the older population and people with high blood pressure to be aware of. And there have been some newer treatments out there for some of the complications. So that would be interesting to put in the newsletter so that people are aware of potential things that can be done to treat glaucoma complications that weren't available in the past.
Agree. Unfortunately, glaucoma is very, very prevalent in my family and often exacerbated by diabetes, whether type 1 or 2. So I think there's also a way to potentially link it to, healthy eating and other nutrition tips, because, when people's diabetes spikes, usually it makes their glaucoma worse, which is unfortunately irreversible once the damage is done to your eyes. So agree with you there. I think that we can also, I really want to hear people's opinions here. I think we can also, maybe link out to a glaucoma resource, because it is National Glaucoma Awareness Month in January, if we want to focus on the seasonal affective disorder and mental health, because January, I think, is the month with the shortest days. So it is when people are most likely. Also, I know people feel this sort of slump from the holidays in January often. So I know mental health is like a really strong topic at that time. So definitely open to being as flexible as possible. We just only have but so much real estate, so we can't talk about everything. Any thoughts, reactions?
Yeah, I think linking out to glaucoma resources will be really helpful. I don't think focusing totally on like a healthy weight reset is super necessary, just given that it's going to be a topic all over the place. So if glaucoma and seasonal affective disorder is a top priority, I think focusing on one of those makes a lot more sense.
Thank you. Any other thoughts before I put it to a vote?
I did want to volunteer a resource, if that is okay.
Yes, of course.
I am an employee of Community Healthcare Network. I am a health educator. We do have dietitians, nutritionists. We also have an iMobile clinic. Maybe that is something that I will be more than happy to share the contact information. That could be a resource that's available to the community that can be included in the newsletter for this community board, or also maybe coordinate some sort of event where the Vision or the iMobile clinic can be stationed at a local area. I'll be more than happy to pass on information about that, and also put y'all in contact with the Director of Nutrition Services at Community Healthcare Network to assist with this process, if that is something that is of interest. If interested in the workshop as well, I might be able to also have a nutritionist do a presentation specifically on this topic. Be more than happy to share my contact if that is something that y'all are interested in.
Please drop your contact in the chat, and I'll make a note of it. That's definitely something we're interested in. We're trying to get this committee to be as helpful to our community as possible. We do have a April health fair, and so bringing the mobile clinic to the health fair would be great. But if there are other resources that we can link people to in the meantime, that would be excellent. So please drop your information. If you see my email, which I shared earlier, please also shoot me an email.
Yes, I did save your email. One of our health centers is actually within the CB17 area. It's Community Healthcare Network East New York location.
Okay.
So yeah, I just sent my email there. I can share more information once contacted. Yeah, thank you.
Okay, thank you so much. I am noting your email down. Sorry, I just want to make sure I save this. Okay, so let's select a topic for January. So I think we're between glaucoma prevention and nutrition tips, like combining the two, or seasonal affective disorder and mental health. So if you think that our blurb should be about glaucoma and nutrition, please raise your hand. Okay, I see 8 hands raised. And if you think that we should focus on seasonal affective disorder and mental health, please take your hand down from the first vote and raise your hand for SAD. Okay, I see 3. Okay, so looks like we are going to talk about glaucoma for January. Okay, thank you all. That's really helpful. I'm gonna stop here so that we can have time to discuss other topics, and then we can discuss February and March during our next meeting. So thank you all. Really appreciate it. I'm going to turn it over to Tiffany Anderson, who is our Brookdale CAB, if you have any updates.
Sorry guys, I'm like on the way back from the airport, but yeah, I haven't had any other updates other than the latest ones. This month, there was actually a discrepancy with the meeting invite, so I am actually still waiting on updates. So once I can definitely send that over to you, Azra, and then we can forward it out to everyone.
Okay. Since you haven't joined in the last few months, I think if you have any updates that have come over the last few months about like what's going on at Brookdale or any plans, I think would just be helpful to share here.
Okay, sure. Yeah, I can actually pull up my last notes. One second.
No problem.
Okay, guys, have to give me 1 second. My connection is a little. 1 second, guys.
No problem. And just as a heads up, once we get the update from Tiffany, we can move on to INT 1303. So I just want to make sure that we get, the updates from our community hospitals, and then would love to turn the floor over to our guests.
Okay, guys, I'm so sorry, but I am having a little bit of trouble pulling up my notes, and I'm not in the best of connection services right now. So, Mazra, do you want to move, and then we can maybe come back in a few minutes so I
Yeah,
don't hold you guys up?
let's do that. Thank you. Okay, so I want to turn it over to our guests. I'm not sure who exactly wanted to speak first, but you all can please feel free to let us know why you joined us today and what you wanted to talk about.
Yes,
Uh,
absolutely.
Good thing. Hi, everybody. I'm Joseph Tino. I'll kind of get us started. We have a bit of a prepared statement. We are a group who is both has members within Community Board 17 and outside of it. And we are here tonight as a team of public health advocates in support of Intro 1303. This bill was introduced by Councilmember Shahana Hanif of Community Board 6, and it would require the NYC Health Department to create a public education program on fertility treatment and insurance coverage. What it does is it fills a major gap, information gap that would affect thousands of New Yorkers. And we really, more than anything, want to commend the council members, Farah Lewis, Rita Joseph, and Chris Banks, who represent Community Board 17 for co-sponsoring this bill from its inception.
Hi everyone, good evening again. As mentioned earlier, my name is Christina Medji, and I'm a Master of Public Health student focused on our health policy and access. As mentioned, I'm joined today by several colleagues of mine who share a vested interest in the future of fertility access and education in New York. As a Haitian woman who grew up in Flatbush and of immigrant communities where navigating the health system was often confusing, intimidating, and heavily shaped by misinformation or lack of clear guidance, for communities and individuals like myself, that information gap becomes an equity gap as well.
As some may know and many do not, New York was one of the first states to mandate Medicaid coverage for fertility testing and treatment options back in 2019. And this was a groundbreaking feat because fertility services have historically been extremely inequitably distributed. However, due to a lot of misinformation, the demographics of those that receive these services have remained largely unchanged. And with roughly 47,000 individuals in this current area on Medicaid, this bill is a huge opportunity to address fertility health inequities within the community.
As my peers have mentioned, right now, many residents, particularly in Caribbean and immigrant communities like those in CB17, do not know whether fertility testing, medication, or IVF is covered by insurance or Medicaid. Even when partial coverage exists, families often assume they cannot afford the care or feel unsure of where to start. As someone who has worked in social services, I have seen firsthand how women delay or abandon care, not because treatment is medically out of reach, but because information is out of reach.
So, as we know, in communities all over Flatbush and Crown Heights, language barriers, cultural stigma, and low trust in the health system can only compound all the challenges that were mentioned. So, expanding clear, multilingual fertility information has to be a health equity priority. This bill is one of the first steps in addressing this issue, and it will help millions of New Yorkers to understand their rights to access fertility support here. The initiative fits directly within this community's priorities around public health access, education, and supporting underserved families.
Yeah, as you can hear, social and economic barriers weren't enough. Many also face challenges navigating the complex healthcare system. As a health educator, I see firsthand how overwhelming the lack of clear, centralized information can be, how it can delay seeking care or support altogether. As a healthcare provider, I educate patients about fertility awareness, treatment, and patient advocacy, but with your support, the impact can be even greater.
Yes, and our ask is very, very simple. We hope Community Board 17 will push relevant council and coalition members to support Intro 1303 and ensure that the New York City Health Department engages communities like ours in meaningful, culturally relevant ways, in the sense that CB17 endorsement or recommendation can amplify the importance of this issue for the City Council and for the Health Department's outreach strategy. Thank you so much for your time.
Thank you all. Thank you for joining, and thank you for coming with that prepared statement. Before I respond, do any committee members have questions or response for our guests?
Hi, it's Vanetta.
I just have a question. How is this information going to be disseminated to patients? Because as an OBGYN who used to work in a community health center, sometimes the patients, I'm the last person the patient comes and sees. They're not getting regular care, and they've, talked to a bunch of other people who may or may not have suggested infertility workup, and then they just happen to come in for an annual checkup, and I'm talking to them about it, and this is the first time they're hearing it because their other clinicians haven't mentioned anything about it to them because they weren't going to like a dedicated women's health clinician.
Yeah, I don't mind answering that, team members. Well, this is a proposed bill, and that's why we're trying to spread the word about it so that we can get more support for this. This bill will require the New York City Department of Health to have a public health campaign that will be displayed in all neighborhoods, public transportation. The campaign will be relevant to the communities that they serve, right? Diverse. It would be in different languages as well. Languages in specific areas will be, in relation to the community, the languages that are already there in that community, so that it can be relevant and accessible information. It also should be done in like plain language, right? So most of the education will be reliant on the Department of Health and the campaign that they will host, that they will be putting on. So if this bill is passed, then shortly after, we expect the Department of Health to then launch this campaign or start working on that. And yes, you are right. As a health educator, that is something that I have definitely noticed. A lot of patients don't even know. They have been dealing with this for a long time, trying to manage infertility, manage the stigma around not being able to have children or not being able to sustain a pregnancy or dealing with miscarriages and not even knowing that there is support available. Like our classmate Holly mentioned, this is this has already been covered, and parts of it are covered by even Medicaid, and some people are not even aware of that. So this campaign will be a major, push for that information to be out into the public, and then in ways that they will be able to grasp that information. Hopefully, that's definitely the goal.
Any other questions?
I have one. One of the questions I have is, I know that this bill is pushing, according to what you guys mentioned, is to push for educators. Why not have community health workers do this work? Or can community health workers do the same work?
I'm just wanted
So,
to. Oh, sorry. Go ahead.
no, Christina, you go ahead.
No, I was just going to say that I believe that community health educators may also be able to do it. I think she was saying that not sorry, I just lost my train of thought. Holly, go ahead.
I was just going to say that specifically, as like the bill is mainly focused on creating an educational media campaign to be displayed and disseminated around the city. So I do believe that community health educators can do the work as well, but this specific bill will focus on the media campaign.
Yeah, and just want to add to that, if that's okay. A lot of these campaigns, right, and even the work that health workers do is based on funding, right? So if the city is able to see that this is a need that is there, right, what we notice is that when Medicaid services started covering these services, more people started accessing them, right? They weren't aware that they can actually get these things covered. When they became aware of that, then they started seeking more services. But what we notice is that Black and Latinx families, we're still not aware, and we're still not seeking those services, right? So this campaign was proposed so that we can clear up some of that misinformation, right? About fertility services, cost of fertility treatment, so that then it can become more accessible. Now, if the community, right, if the city responds really well and an interest is shown about this case, then what we hope to see as public advocates is that money will be, more money funding will be available so that more work can be done around spreading awareness about this, right? But it all starts with, people like us encouraging people to have more discussions about this and also to promote this bill.
Thank you. Any other questions? Okay, I do have a few questions. One, if you all could just restate how you know each other and how your what your relationship is to the bill, just so I understand, who I'm talking to.
Hi, we're all students of CUNY School of Public Health in the Health Management and Policy program or concentration.
Got it. So is advocating for this bill like part of a course?
Correct, yes.
Okay, cool. Thank you. That's very helpful. And so your ask of the community board specifically in this committee is for us, because you said that Rita Joseph, Farrah Lewis, Chris Banks are all already co-sponsoring the bill. So what exactly are you asking for us to do to support it?
To spread more awareness about this, right? The more people that we have speaking up about it, the more support the bill would acquire and the more that it will be passed by the health committee, right? So that it can be approved and passed on. So our ask is that, we have these conversations, that we encourage people to be aware of this bill and that it exists so that it can be passed through as quickly as possible so we can have the campaign out.
Okay. And do you have a timeline as far as when this bill is up for a vote?
Well, the last time that it was, sorry, go ahead.
No, go ahead, Isabel, sorry.
I was going to say that the bill was already introduced in June. As we know, sometimes things like this can take time, right? Moving through committees. So we are unsure of how long it will take. But since it is now going to be approximately 5 to 6 months from it, we hope that the next voting process will occur soon. And that it's also a part of what we're here trying to encourage more discussion of the topic
Okay.
and support of the bill.
Okay, great. I really appreciate you all joining. I think in general, these are the kinds of conversations that we want our social services committee to be having. So we just appreciate your presence, those of you who live in CB17 and those of you who don't. I will take this information to the executive committee to see if the Community Board 17 as a body is willing to I guess sponsor this initiative, and then we can discuss it with the wider community. I can share it during the committee report at the next community board meeting. If you all stay in touch, you can let us know if there are any pushes that are we trying to get people to sign a petition or write letters to their Congress people or their assembly members, and see if that's something that we can help with. And we're happy to be in conversation over the next few months. I think it would also be helpful for somebody from Community Board 17, whether it's me or another committee member, to have a voice in the actual materials that are being created, because we do want to make sure that they are culturally sensitive to the people in our community and speak to the needs that people are having and maybe misunderstandings that people have about fertility treatment. So would just love to continue in conversation with you all. I can't endorse it right now on my own. Like I said, I have to bring it to the executive committee and we'll discuss it as a body, but I will do so and keep in touch with you and let me know if there's anything else that you need from us as a committee.
Thank you. We really appreciate you hearing us out and being so receptive to what we had to say tonight.
Of course. I appreciate you all for coming and being, active participants in the meeting. So thank you all. Okay, anything else on this topic before we move back to Tiffany? Okay. Also, Isabel, I have your info. Would love to, be in contact about the eye clinic and the glaucoma and all the other topics. So again, you all are welcome to join our meeting anytime. We're the fourth Monday of every month. And yeah, thank you all. So I'm going to turn it back over to Tiffany to give us the update from Brookdale.
Hello, it's me again. So yes, very quickly, there is a project going underway at Brookdale, mainly for the emergency department, which will be happening in a series of phases, starting with phase one, which should still be expected to go live by Christmas. That mainly will focus on the new crisis psych emergency program, which will host 15 beds, 4 exam rooms, a new radiology waiting area and walk-in entrance, a 5-bed wing for post-acute trauma patients, which would have 24-hour monitoring. Sorry. Phase two will also include an upgrade to the existing radiology department and nursing station at Brookdale, along with an upgrade in the electrical and fire alarm system. All of these are expected to go throughout 2026, so we do expect to get updates at the next meeting. So I will provide anything that comes up after.
Thank you. Any thoughts or questions for Tiffany? Nope. Okay. Hearing none, that is our new business. That was probably the longest new business section we've had for a while. So again, appreciate everyone coming and your active participation. It's always helpful to feel like we're able to actually share a good amount of information with our community. So thank you all. Does anyone have any unfinished business they want to bring up? Okay. Hearing none. Can someone please move to adjourn the meeting?
I move to adjourn. Vanetta.
Thank you. Do we have a second?
Second.
Okay, thank you. The motion has been moved and seconded. All in favor, say aye.
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 Have a happy holiday, everyone. Vanetta, I will connect with you about the newsletter and hope you all enjoy time with your family, and we will speak in a few weeks.
Have a good night, everyone.
Have a good night. Happy Thanksgiving.
Thank you.
Thank you. Good night. Happy Thanksgiving. Good night.
Thank you, Ms. Lyons. Have a good night.